Something that we talk about often here is healthcare and different ideas that have come up government-wise and issues that people have. But one of the things that I wanted to point out is we've talked about this in particular because of COVID. It really exposed how broken our healthcare system is, the healthcare deserts that exist around in our community, and also, but the main fact is how unhealthy we all are. And we learned about these comorbidities and how they contributed to many of the COVID deaths around the world, basically.
They talked about it last week. There was a study that a majority of the people that are having the biggest issue are obese.
Mm-hmm.
The obesity thing, I'm sure you talked about that.
Yeah, we've talked about that many times. Joining us live on the air right now is Dr. Reagan Anderson. Now, he is a doctor, a combat doctor as well, and he has written the book, Universal Death Care, A Solution for Healthcare in the Age of Entitlement. And I want you all to have an open mind. This is really important because I know many of you, think about universal health care and just say, absolutely not. The government screws everything up. Just look at the VA. But I invited Dr. Reagan Anderson on to give us his perspective as a doctor and as a patient at sometimes. Good morning, Dr. Anderson.
Thank you for having me.
Thank you for joining us. Now, give us a little bit of background about you so we understand your perspective in how you created this concept of a solution to the healthcare problem.
Absolutely. So I'm a physician. I did 2 tours in Iraq as the 1st Reconnaissance Battalion surgeon. And then I got out of the military and went into a specialty, dermatology, and a subspecialty of Mohs surgery, which is where I remove skin cancers off of people's faces and then do the cosmetic reconstruction.
Wow.
Not that Myrtle Beach has any of that, but some places do. So I have my own practice, and I got absolutely sick and tired of seeing a healthcare system that was failing the majority of people.
Absolutely. Now, what are some of the failures that you see from being a doctor?
Well, I see that the only person or only party that's held accountable for health care is the physician. So insurance companies are not, the government is not, the patient is not, the pharmaceutical industry is not. The only party that's held accountable for anything is the physician. Mm-hmm. And in any relationship, in any system where only one party is held accountable for the acts of everybody else, it's just a failing system.
Dr. Anderson, one of the things that comes to mind is the treatment of COVID patients, how frustrating it was. I mean, one of my good friends just went through losing her husband to COVID, and she was so frustrated with the doctors. She felt like they didn't know enough about COVID. They weren't giving the right, medications that were available. And you're right. It really boils down to, because that's the first person, usually the only person in the chain of command that a patient deals with.
Well, 100%. So try to call your insurance company and try to complain and see where that gets you.
Yeah.
Try to call and get an explanation for what you're actually allowed to or not allowed to have covered. And good luck with that. I, as a physician, can't even get those answers. I can't order some tests as a physician because somewhere in some policy manual it is written that with private insurances, this plan can have a needed MRI covered and this plan does not need it or deems it's not needed because some box isn't checked. It's just wholly and completely inappropriate. And absolutely, physicians did not handle this pandemic appropriately. And how could we? It's a brand new thing. And so I think people want physicians to be the omniscient, all-powerful, all-knowing body that can snap their fingers and reverse, 10 decades or 8 decades worth of really poor health choices. Or in a new pandemic, we know exactly what we're dealing with as if we've been dealing with it for 20 years. Mm-hmm. All we are is humans trying to do the best we can, follow the scientific principle. And we need partners in this. Mm-hmm. What we do not need is for something that's completely new, which COVID was, for the entire world to look at us and say, you have to be perfect from the start. There's just no way.
Right. We're talking to Dr. Reagan Anderson. You wrote a book called Universal Death Care. Now, I'm guessing, being that it was published in March of 2020, that you wrote this obviously before a pandemic existed?
Absolutely.
Okay.
It was a year and a half in the making, but I think the title is perfect because what we have in America is death care. We do not have health care.
That's right.
And
I agree with that.
Yeah, so we are trained as physicians to treat disease and death. We're not trained for prevention. We're not trained for how to keep your mind, body, and spirit healthy. And we're actually paid more if we treat death than if we treat how to prevent things, or we teach how to prevent things.
So this death culture in this realm of healthcare, how can people navigate through that to keep themselves healthy? It falls on you, the person, the individual, to keep themselves healthy. They have to do their part.
100%. So if you look at just last week, the study that you referenced prior to me coming on, 90% of COVID deaths in the planet happened in obese nations, America being the chief obese nation on the planet.
Right.
And if you look at who COVID typically hits, it is not the healthy. It's not the people who are eating their fruits and veggies and exercising. It's the people who are doing everything wrong. And so if we want to start taking responsibility for our actions, and if we want to actually have a healthcare system that isn't set to collapse in 5 years because everything is running out of money, then everybody has to take personal responsibility. And it really is amazing that the quote-unquote conservatives out there want to do everything except for take care of themselves. And yes, I understand this is a conservative platform, but the liberals are just as guilty. Everybody in America wants to eat what they want, wants to drink what they want, wants to smoke what they want, and as much as they want. And then they want to go to the doctor and have us snap our fingers and make everything better. It doesn't work like that.
Right, especially if you're living a lifetime of that, and then you start showing problems when you're 50, 60. And now I wanted to ask you, though, what is your concept? You asked us in the book to have an open mind, especially when it comes to universal health care. And I want to have a solution to health care. And I know people who don't have health care, and it is terrifying. Please explain to us what your concept is. I know you have like 16 tenets that we should kind of consider when we're, creating a healthcare policy, but what's the main crux of it?
Well, I think my namesake, my first name is Reagan, so I think my namesake might agree with me. It's personal responsibility and accountability. So just like you just said, you cannot destroy your whole body your entire life, and then when you hit 65, go on the government dime, because then you're on Medicare, and now the government has to be responsible for trying to make you healthy after a lifetime of poor choices. It cannot be that way. Healthcare in America is going to drastically change in the next 5 years. One of the reasons is that Medicare is going to be completely bankrupt. And so we not only are seeing Social Security that has over a $40 trillion deficit right now, Medicare is also going to be gone in 5 years unless the government bails it out. But at what point do we as citizens say it's my personal responsibility to take care of myself? I'm not asking everybody to run marathons. I'm asking everybody to eat a carrot tonight for dinner. I'm asking people to have a little exercise and stop smoking. And if you don't want to do that, that is fine. This is America. I believe in freedom and I believe in choice. But what I don't believe in is smoking 3 packs of cigarettes a day and asking everybody else to cover your health care costs when your body naturally starts to fail. And so my proposal is, if you want to lead an unhealthy life, that's fine. This is America. Do it. But pay your share now of what those poor health care choices are going to cost you in the future. Now, the only way to really do that is to focus on prevention from grade school on, and physicians need to start focusing on prevention so that we actually know what we're talking about and everybody's on the same page.
But you know what, Doctor? I can hear because, we are a conservative platform, as you said. I can hear people that are in areas of the community that would say, well, we don't have the luxury of prevention. We don't have the luxury of good quality food and good prevention, medical, intervention. Because, you do have to see the doctor when you're healthy, too. You need to get your checkups, get your testing done. And some people don't have the luxury of that.
100%. We need to start having, if you will, a quote-unquote sin tax on the cigarettes and the Pepsis and Cokes and all of that stuff, so that we can actually subsidize good, healthful choices in every community in America. One of the big problems with the vaccine rollout right now is that there's huge areas where there's just no pharmacies and there's no physicians, and these people need vaccines and they need protection as well. So if we want to actually have a level playing field where we are the land of the free and the home of the brave, then everybody needs to have an equal chance at that. And an equal chance of that means adequate health care. And I'm not talking Medicaid. Medicaid is atrocious. Medicaid creates different classes of citizens in America. And that we cannot have. But we're talking about adequate access to good prevention strategies, food, education, clothing, health care. And then when they do their choices with that, they make their individual daily choices with that. Once they have the ability to make good choices, then the responsibility is on them, and then they have to be accountable for those choices later on. But I 100% agree with you that we have to start leveling the playing field.
What is out of all the different health cares that exist around the world, I don't know if there's any that resonates with you and what you would like to see happen here.
So I don't think any of them would work if we were just to pick them up and move them into America. I don't think any of them would work. I think we need to take the best from each country. But I do agree with the World Health Organization that France is probably the best. America is 37th. We're ranked 37th on the planet for healthcare, the richest country that's ever existed, and we're 37th. And listen, I'm a proud American. I fought for my country twice in Iraq, and I would die for my country. So it's not like I am bashing America, but our healthcare system, we have to have an open mind and actually look at where we stand and not just think that because it's America, it is the best. If we have that philosophy in everything, we won't be the best. We have to constantly strive. So France, for instance, they have a system where they have private health insurance carriers, but the government subsidizes everybody. So you get to pick your health insurance, but it's subsidized by the government. And I think something like that in America
could exist. It's not tied to employment.
No. In fact, if you look at how many people lost their jobs in COVID and how many people then lost their insurance, or they had to do COBRA, which is absurd.
Oh, it's fortune.
It's hugely expensive when you don't have a job. There's no jobs to be had.
Right.
It's just criminal that in the middle of a pandemic, people who were working through no fault of their own now don't have health insurance in America.
It just doesn't make sense. Like I see a really big problem, and and you being a cancer doctor, I bet you have stories that have broken your heart where there are people that are coming to you that probably avoided a doctor for so long until it's like, they're at a point of no return.
Absolutely. And a lot of people come to me when they're 65 and they're finally on Medicare and they have big cancers that they have to have taken care of. And these are not people on the street corner. These are Americans who have worked hard, sometimes 2 jobs, 70, 80 hours a week for their entire lives. Right. And they just can't afford health care. Listen, I see the left and the right. We can all get behind this. I think all of us want to be as healthy as we possibly can be. I think all of us want to take care of our children. Yeah. And I think all of us
the elderly.
And the elderly, exactly. And I think all of us can say we have to be responsible for our actions. I don't see how healthcare is a leftward-leaning or a rightward-leaning thing. It's something that we all need.
Is there a leader that you could point to that would say, this person has it right, I hope this person's policy? I mean, because I don't hear any person that could actually make a difference in this realm, that, policy-wise, doing so. I mean, I don't know if you were a fan of Obamacare or anything else, or the VA, the way the VA operates.
Well, I'm a veteran. I'm a disabled veteran, and I'll tell you that the VA is atrocious. It's an embarrassment, and that is by no means the model by which this country needs to follow for universal health care. But I would say that Michael Bennet, he's a senator of Colorado. He has come up with a fairly decent plan. Please realize that no plan off the start is going to be perfect, but what Senator Bennet has done is he's looked at the options, and he has created a plan that is Medicare for all who want it. And I think that if we do that appropriately and make people responsible and accountable for their actions, then I think that we can actually have a sustainable, and that's what we want. We want a sustainable healthcare system, because a lot of people right now say, I have great healthcare. You're not going to in 5 years. Look at how the premiums have doubled, tripled in the last 20 years. Look at how, all of these things, and eventually it's just going to collapse. So the healthier society is, the healthier the individual is, and the healthier the individual is, the healthier the society is. And we need to stop putting macro and microeconomics into healthcare. There is no or return on investment that you can measure when you actually have a healthy society that can meet its potential.
Absolutely, absolutely. And it has so much to do with education. It is 100%. So tied. I mean, like young people not getting the proper nutrition, not understanding how important it is to take care of yourself and how that interferes with everything they do growing up.
I can't tell you how many kids come into my office with a diagnosis of ADHD. You know, we've all heard of that term.
Yes.
And they're drinking a soda that has 5 times the caffeine content of a cup of coffee and enough sugar, more sugar than they're allowed to have in a week. And people are giving them a diagnosis of ADHD. Get the poison out of their hand. Give them some fruit and vegetables and make them accountable for their choices, and the parents accountable. Don't just shove them full of medications. Educate them on how to take care of themselves.
We're talking to Dr. Reagan Anderson. You know, something really just popped into my head when we started our conversation, and you were saying that, you know, the doctor's to blame for everything when there's a whole host of other hands in the pot when it comes to healthcare. One of the things I wanted to ask you about is the opioid crisis. I was wondering if you had an opinion on that, because one time I was talking about it and how they were holding doctors accountable for it. And I had a friend who's a doctor who no longer subscribes to health insurance or the ADA and does her own thing now. And she said because it's not the doctor's fault, because they are tasked with taking care of the number one, thing that the people come in with, which is pain.
Well, it's interesting. So I was in California. I was a Marine Corps doctor, and California mandated that all of us take a course on pain management. And the course was basically threatening our licenses, threatening jail, threatening fines if we did not prescribe enough opioids to people for pain. And we had to. This was a mandatory course that every physician in California had to take. And you know who sponsored that?
The pharma company?
Right. That's right. who were selling opioids. And then here we go 15 years later, and we've got an opioid epidemic because we've been threatened with jail time, with losing our licenses, and now it's our fault again. Enough. You know, in my book, I throw everybody under the bus. I throw physicians under the bus. I throw politicians, everybody, because it's a systemic issue. And if we want to actually have reasoned outcomes, if we want to have sustainable health care, all of us need to look in the mirror, and we need to ask, is this corporate greed? Is this personal greed? Is this societal greed? And we need to ask, what is right for our country?
Dr. Anderson, now that the book is out, we're in the post-COVID world here. I'm wondering if when this book goes to reprint, will you be adding a chapter? And based on any type of feedback that you've gotten or what you have witnessed during this pandemic?
You know, I'm trying to decide. I sent the book to every politician in America, every national senator and Republican. I've asked everybody to help me to have a seat on the table. Everybody who's read the book, I don't care if you believe in universal health care, if you don't. And I'm not a huge advocate of universal health care, by the way. I'm an advocate of responsibility, and I think there's lots of ways to have responsibility. But I really want everybody to look, just a Google search, see where we rank in the world and come up with your own solutions. But I promise you, any sustainable solution starts with every individual citizen taking responsibility for their actions, holding the politicians, the health insurance companies, everybody responsible. It's the only way that we can have a sustained, reasoned policy.
What state do you live in?
Colorado.
Colorado. Okay. What about the marijuana issue?
Well, it is an issue. You know, I just wrote a chapter in the first textbook on using marijuana for medicinal purposes. And the problem with it is that it's going to have a lot of benefits in the future, but we do not have the studies. We do not have the purity. We basically have a pharmaceutical agent right now that you do not need a prescription for, and we have no idea what dose and what purity is out there. It's a huge problem. The cart is before the horse. We allowed a bunch of people to make decisions based off of pot being harmless and saying you can do anything with it, and now it's snake oil. So I think that there's going to be huge applications for the cannabis plant in the future. But right now, we don't have the studies. We've completely negated the scientific principle in it. And it's such a shame, because by doing that, by doing the easy route of just legalizing it without doing the proper studies on it, we've set it back probably 20 years. Mm-hmm. Now, on the other side, we demonized it before, so we couldn't even do scientific studies on it. So the pendulum has to stop swinging so wildly. It needs to be reasoned and in the center. Mm-hmm. What we should have done is 10, 15, 20 years ago, we should have started doing honest scientific studies, double-blind, placebo-controlled. Mm-hmm. And then once we found the uses for it, had an intelligent policy for rolling it out.
That makes sense. And Dr. Anderson, I was just wondering that, you sent your book, Universal Death Care, to all these people in power, so to speak, and senators and representatives. Have you ever thought of running yourself? And I'm asking you this because we would really benefit from a doctor in the ranks, and I know there are some, but who can have that honest conversation and basically tear down the whole house to rebuild it. I mean, it's this. I don't think what we're looking at, Obamacare and all these other things, can be fixed.
No, I kind of think the baby needs to be thrown out with the bathwater on this one and start from scratch, and it'll be painful. And I have thought about it. I don't know where that's going to lead in the future. I know that if my country calls on me, I will serve it again.
Mm-hmm. Absolutely. Well, I really want to thank you for your time and your honesty. And I know it's kind of like a dangerous road when you're being honest, right?
It is.
Yeah.
Even when you're throwing your fellow colleagues, when everybody is under the bus. But it's the truth, and I think we just need to start taking an honest look at where we stand.
All right, and your bravery continues. So we appreciate that, Dr. Reagan Anderson. Get the book, Universal Death Care, A Solution for Healthcare in the Age of Entitlement. Thank you so much for your time, and we'll put a link to your book on our Facebook page.
Thank you for everything you do.
Thank you. 9:28 on the Liz Callaway Show.